Dr. Michael Eisenberg, a renowned expert in male sexual function and fertility, serves as the director of male reproductive and sexual health at Stanford University. With a career spanning 10 to 15 years in this field, Eisenberg has seen tens of thousands of patients and has witnessed a significant increase in interest and awareness around male fertility, testosterone levels, and sperm quality in recent years. One of the key factors contributing to the rising demand for IVF clinics is the trend of rising parental age. The average age of fathers has increased by about 3.5 years over the past few decades, leading to higher rates of infertility and pregnancy complications. As men and women age, their fertility declines, with peak fertility typically occurring in the late teens to early 20s. Delaying parenthood can result in lower sperm counts, lower testosterone levels, and an increased risk of genetic mutations in sperm cells. The societal shift towards delayed parenthood and the increasing reliance on assisted reproductive technologies like IVF have also played a role in the growing demand for fertility treatments. Factors such as rising parental age, environmental exposures, lifestyle behaviors, and social factors like delayed careers and education all contribute to the challenges faced by couples trying to conceive. Eisenberg highlights the importance of addressing these issues at a societal level to prevent a decline in population growth. Countries like Hungary have implemented incentives to encourage higher birth rates, such as offering tax breaks for families with multiple children. Maintaining a stable population is crucial for economic stability and social well-being, making investments in fertility and reproductive health essential. Regarding sperm quality, Eisenberg discusses the controversial topic of declining sperm quality. He references a study he was involved in that analyzed data from a sperm bank in the United States, which found evidence supporting the decline in sperm quality over time. Factors such as environmental exposures, lifestyle choices, and genetic mutations can all impact sperm quality, leading to fertility issues for men. Various factors have been attributed to the decline in sperm counts, such as the obesity epidemic, sedentary lifestyles, environmental exposures, and the prevalence of cell phones. However, when researchers analyzed the data of men over time, they found that there were no significant differences in lifestyle factors or habits that could explain the decrease in sperm counts. This led to the conclusion that there is indeed a decline in sperm counts over the years. Studies have shown that exposure to certain chemicals in the environment can impact sperm quality and hormone levels. Chemicals like phthalates and bisphenol A, commonly found in plastics, have been linked to endocrine disruption, affecting hormone levels in the body. These chemicals can mimic or block hormone actions, leading to adverse effects on reproductive health. Eisenberg also discusses the impact of heat on sperm quality. Factors like saunas, hot tubs, and high fevers can temporarily lower sperm counts. Additionally, the use of cell phones and laptops, which emit radiofrequency signals and heat, can also affect sperm quality. Studies have shown that exposure to these devices can lead to DNA damage in sperm, potentially impacting fertility. When it comes to lifestyle choices, Eisenberg advises against using plastic water bottles as they can leach harmful chemicals into the water. He recommends using glass or metal containers instead. He also suggests avoiding tight underwear that can increase scrotal temperature, potentially affecting sperm production. Regarding the use of technology, Eisenberg acknowledges the concerns about keeping cell phones close to the genitals. While there is some evidence to suggest that radiofrequency signals from cell phones can impact sperm quality, the data is not conclusive. He advises patients to be mindful of where they keep their cell phones and laptops to minimize potential harm. Eisenberg explains that sperm quality can vary based on the time of year, with hotter months leading to a decrease in sperm quality. He also mentions that certain occupations, such as drivers and cyclists, can have lower sperm counts. Additionally, obesity is linked to lower sperm counts, as excess fat can lead to hormonal imbalances and decreased testosterone levels. Alcohol consumption can also impact sperm quality, with moderate use not significantly affecting sperm counts, but higher levels of alcohol intake leading to lower sperm quality. Eisenberg discusses a mutation in East Asian men and women that affects their ability to metabolize alcohol, leading to lower sperm movement when they drink. When it comes to evaluating male fertility, Eisenberg recommends looking at overall health, lifestyle factors, medical history, and medications. He suggests conducting a semen analysis to measure sperm count, motility, and shape, as well as checking hormone levels. He emphasizes that fertility is a team sport and encourages partners to also undergo evaluations to determine any potential fertility issues. Eisenberg addresses the misconception that fertility issues are typically attributed to women, noting that male factors contribute to fertility problems about half the time. He stresses the importance of evaluating men for fertility issues and not assuming that the problem lies solely with the female partner. Regarding testosterone levels, Eisenberg explains that testosterone decline is a real phenomenon, with studies showing a progressive decrease in average testosterone levels over the years. He mentions that testosterone levels typically decline by about a percentage point every year after the age of 20. Factors such as obesity, lack of physical activity, and stress can contribute to lower testosterone levels. Testosterone plays a crucial role in various aspects of male health, including energy levels, sex drive, mood, sleep, concentration, muscle growth, and bone health. Low testosterone levels can lead to symptoms such as decreased energy, low sex drive, and potential health issues like osteoporosis. Eisenberg discusses the impact of testosterone on muscle growth, bone turnover, and overall health, emphasizing the importance of maintaining normal testosterone levels for optimal health and well-being. Eisenberg also touches on the potential effects of testosterone treatment, noting that while some men may experience improvements in symptoms like low energy and sex drive, not everyone responds positively to testosterone therapy. He mentions that testosterone treatment can have side effects, such as impacting sperm production and potentially causing adverse effects in some individuals. He explains that testosterone therapy can lead to side effects such as hair loss, breast growth, acne, and an increase in red blood cell count. However, he reassures that monitoring these side effects closely can help manage them effectively. Eisenberg also addresses concerns about the risk of heart attack and stroke associated with testosterone therapy, citing a recent large trial that found no significant difference in the risk of cardiovascular disease. The conversation shifts to the topic of hair loss and the use of finasteride as a treatment. Eisenberg discusses the potential risks of finasteride, including impacts on sexual function, and highlights the importance of monitoring patients for any adverse effects. He also touches on the relationship between testosterone levels and hair loss, suggesting that higher testosterone levels may contribute to hair loss. The discussion then moves to the topic of erectile dysfunction, a common issue affecting over half of men over the age of 40. Eisenberg explains that erectile dysfunction is primarily a vascular issue related to blood flow, often influenced by factors such as diabetes, obesity, high blood pressure, and high cholesterol. He outlines various treatment options for erectile dysfunction, including medications like Viagra and Cialis, penile injections, vacuum erection devices, and surgical implants. Eisenberg also shares insights from his research on penile length, noting that studies have shown an increase in average penile length over the past 30 years. He suggests that earlier puberty onset may be a contributing factor to this trend. The conversation touches on the potential implications of this increase in penile length on sexual health, with Eisenberg emphasizing that the changes observed are not likely to have a significant impact on sexual function. Eisenberg explains that penile prosthesis surgery is often considered a last resort for men with erectile dysfunction, as it is a more aggressive treatment compared to options like Viagra or shockwave therapy. Shockwave therapy involves sending shockwaves into the penis to induce microtrauma and promote new blood vessel growth, potentially improving erections. However, the data on its effectiveness is still inconclusive. He also touches on the importance of pelvic floor strength in men, noting that tight pelvic floor muscles can lead to urinary issues and scrotal pain. Pelvic floor exercises can help improve these symptoms, but Eisenberg advises against overstrengthening the pelvic floor, as it could lead to other dysfunctions. When it comes to testicular cancer, Eisenberg explains that it is most common in young men, typically in their 20s to 40s. The main symptom is a painless mass in the scrotum, and early detection is key. Regular self-exams and seeking medical attention for any abnormalities are recommended. Moving on to prostate cancer, Eisenberg describes the prostate as a walnut-shaped organ located beneath the bladder. Prostate cancer is more common in older men, with screening typically starting in the 50s. Lifestyle factors like obesity and diabetes can increase the risk of prostate cancer, so maintaining a healthy diet and exercise routine is important. Eisenberg also discusses Peyronie's disease, a condition characterized by a curvature of the penis due to scar tissue emaciation. This can make sexual intercourse challenging, but there are effective treatments available. He encourages men to speak to their doctors about any reproductive health concerns they may have, as there are solutions for many conditions. In terms of maintaining optimal sperm count, testosterone levels, and erectile function, Eisenberg emphasizes the importance of a healthy lifestyle. Eating a balanced diet rich in whole grains, fruits, and vegetables can support reproductive health. He advises men to avoid high-calorie foods, excessive sugar intake, and to maintain a healthy weight. Avoiding processed foods and high-calorie, high-fat foods is also recommended. Additionally, he suggests getting medical conditions treated, as conditions like high blood pressure can impact fertility. Eisenberg also discusses the correlation between erectile dysfunction and depression, emphasizing the importance of seeking therapy and treatment for mental health issues. The guest talks about the impact of childhood trauma on sexual health and fertility, noting that trauma can affect sexual function significantly. He recommends working with therapists and sex therapists to address psychological factors that may be contributing to fertility issues. In terms of supplementation, Eisenberg mentions that antioxidants like coenzyme Q can improve fertility. He suggests taking a multivitamin or considering male fertility blends that contain specific supplements known to benefit reproductive health. He also discusses the role of protein in a balanced diet and its importance for overall health and fertility. Eisenberg expresses his passion for researching male reproductive health and understanding the reasons behind declining sperm counts. He aims to engage the scientific and pharmaceutical communities to develop therapies for male fertility issues. The guest emphasizes the need for FDA-approved therapies for male fertility and hopes to contribute to advancements in the field over the next decade. Eisenberg's closing message to men struggling with fertility issues is one of optimism and encouragement. He advises men to seek medical help, talk to friends, and consider consulting a male reproductive specialist for additional perspectives and treatment options. He acknowledges the bravery required to address fertility issues and emphasizes the availability of various treatments and solutions.